Hi everyone, welcome to Better Patient Outcomes with Coloplast Care. My name is Robin Frost. I'm the Continence Care Market Manager with Coloplast Canada, and I'm very pleased to be here today. At Coloplast Canada, our mission is to make life easier for people with intimate healthcare needs. Coloplast has been recognized globally as one of the world's most innovative companies by Forbes, with the Red Dot Award design for several products, and for 4 consecutive years as the best medical device company in the world by PatientView. PatientView is a UK research organization who surveyed 463 patient organizations in 58 countries. But the impact that we see, and that hopefully you see in your roles, is that Coloplast provides high quality medical devices and outstanding support for your patients. Now, to dive into some of the background behind what I'm going to share with you today, we know that for neurogenic bladder management, intermittent catheterization, or IC, is the gold standard. It's been shown to result in better health outcomes, result in fewer complications, and provide a better overall quality of life by allowing patients more freedom. Despite this evidence, despite the evidence, that IC provides the best patient outcomes for neurogenic bladder management, we know that patients still struggle to catheterize in accordance with their clinician's instructions or recommendations. Even though IC delivers better clinical outcomes for patients than an indwelling or than a Foley catheter, there's still significant challenges with compliance to IC. The training is challenged because nurses have limited time available to be able to train each patient in IC. During IC training, even if the nurse does have, say, sufficient time, patients are often overwhelmed. So even if the nurse has time to explain IC and demonstrate it in detail, it's hard for a patient to comprehend and absorb all those details and information when they're feeling upset. Lack of adherence is a key concern, as many patients stop intermittent catheterization treatment within the first 5 years. Patient barriers with their own anatomy can lead to poor adherence. Nurses are of key importance as they help patients overcome their physical and emotional barriers to IC, thereby supporting adherence. The SCI study quoted here specifically notes that education of patients on catheterization techniques and periodic follow-up is necessary to maintain patient compliance. So we know that when patients struggle to be compliant with IC, they may revert to using Foleys or indwelling catheters. This, of course, can lead to poor quality of life and can lead to increased complications such as UTIs. Looking at it from a patient's perspective, we see that during the introduction and training, there can be lots of fear, denial, and confusion upon learning they need to catheterize. Helping patients develop trust in their IC treatment can be done by identifying issues and helping them find the solutions to overcome the issues. Choice of product is key in the training situation, and development of good habits are linked to both the choice of the patient, both in terms of catheter types and IC routine. Even after leaving the doctor's office, users often struggle to adjust to intermittent catheterization at home in terms of building routines and in terms of returning to their regular activities. So Coloplast Care, our patient support program, is designed to aid this transition home and improve user adherence or patient adherence to their intermittent catheterization routine. Patients often have a lot of questions and concerns once they are back home. So everything from the mechanics of catheterization and building a routine to being able to catheterize in specific situations, building catheterization back into their normal kind of rhythm of life, whether or not they really need to catheterize as often as their clinician has recommended. They're seeking reliable information on bladder management and products. They're often distressed and confused about where to look for this information and where to gain trustworthy information. Offline info is not always available, and online info may not always be reliable or valid or current. Coloplast Care addresses these and a variety of other issues and questions users have. So we talked about compliance, and we know that many patients struggle to accept their intermittent catheterization treatment. Barriers are many, and they vary from patient to patient. Positive motivation can move the patient from fear to trust in their IC treatment. Coloplast Care has been structured to address the physical and emotional barriers to intermittent catheterization that patients experience. When patients get home, intermittent catheterization is often not the only health care issue that they are dealing with. They may have prostate surgery, cancer, MS, spinal cord injuries. So Coloplast Care has been customized to address a variety of patient challenges. So let's step aside for a brief moment and discuss how Coloplast Care helps intermittent catheter patients to experience better outcomes. Patients enrolled in Coloplast Care receive individualized support from a dedicated Coloplast Care advisor, either over the phone or by email if they prefer. Personalized nurse-validated education through our Coloplast Care website and email program. Routine self-assessments to identify and address concerns, such as our continence check, all of which can help lead to improved patient outcomes. So going back to our study, we compared the two groups of end users, those enrolled in care and those not in a patient support program. These results are the results from the users who are enrolled into care. We saw a 47% reduction in unnecessary emergency department use and a 77% reduction in hospital overnight admissions. This is within the first 30 days of starting intermittent catheterization compared to intermittent catheter users not enrolled in a patient support program. The citation you see here is directly from the poster associated with the study, which was presented at the International Society for Pharmacoeconomics and Outcomes Research. Coloplast Care was associated with statistically significant reductions in both ER visits and overnight hospital stays within the first month after starting or after using intermittent catheters, pardon me. So we can say that Coloplast Care delivers better patient outcomes. So how do we do that? Coloplast Care supports patients as they transition home in several ways. We have our Coloplast Care advisors. Again, this is individualized support from a patient-focused advisor. Advisors are assigned by territory, so patients are speaking to the same advisor throughout their care journey. These advisors not only can help them with compliance and establishing their routines and product selection and samples, they're also specialized in assistance to locate a dealer and navigating reimbursement options, which we know in Canada can be challenging. Then we have our tools for self-assessment. Routine self-assessments to identify and address concerns via My Continence Check. My Continence Check is an online tool. Those who participate in the Coloplast Care email program will receive it quarterly, but it's also available anytime on our website. And it's a series of 6 questions. It takes about 2 minutes to answer and will help identify any of the issues commonly associated with intermittent catheterization. Any answers that indicate a potential issue will trigger an automatic follow-up call from our Coloplast Care advisors. And of course, if the advisor feels that there's a clinical concern, the patient would be directed to follow up with their healthcare professional. Finally, we have our clinician validated education, which is available through both the Coloplast Care website and our email program. There's also a lot of free tools, information, supporting resources, and samples. So care advisors are trained to promote IC compliance, and this is really key. So the advisors will speak to the importance of following their clinician's instructions, can walk them through how to catheterize using our products, will help assuage any of the fears and misconceptions about intermittent catheterization, can help patients discuss building intermittent catheterization into their daily schedule and or work schedule, can discuss hygiene practices, and again can help locate a supplier that meets the patient's needs, and also discuss and help the patient navigate various reimbursement options. Coloplast care advisors are trained to discuss adherence to intermittent catheterization routines and daily routines to promote catheterization compliance. What you see here is an example of the Coloplast care call flow. So once a patient is enrolled, their samples are usually sent within 24 hours and received within 2 to 5 business days, depending on where in Canada the patient is located. The first couple of calls are focused on acceptance. So advisors will assist patients if they need help receiving catheter supplies and will help patients to overcome barriers to accept IC as their treatment. The follow-up calls focus on compliance. So advisors will discuss the importance of adherence to the catheterization routine and help integrate and support IC in the patient's daily activities. The following follow-up calls focused on routines. So advisors can assist in product reordering as needed and provide support in incorporating intermittent catheterization into daily routines. Typically within about a month, we'll follow up with the user to ensure they're starting to resume their normal activities if possible and can help troubleshoot if needed. Coloplast care advisors will work with each patient for as long as it takes in order to find the right solution for them. And following that, we'll have routine check-ins through the Continence Check email and the Continence Check online assessment tool. Again, those enrolled into the email program will receive the Continence Check every 3 months, and any issues they indicate will trigger an automatic follow-up call. Outside of that, our care team is always available Monday to Friday from 9 to 5 Eastern Time, so that patients can call back to discuss any issues or questions that they have. Along the Coloplast care journey, both patients and clinicians have access to a number of supporting resources. So first, we have our Coloplast care enrollment form. Completing the Coloplast care enrollment form helps you ensure your patients, of course, receive all the benefits of Coloplast care. There are several hard copy versions of the form which can be provided by your territory manager, and you can also enroll patients or direct patients to enroll online at coloplast.ca/careform. My Continence Check is our routine self-assessment tool. Patients enrolled in the Coloplast Care email program will receive the Continence Check 4 times a year by email in order to assess their overall bladder health. My Continence Check is sent quarterly and asks the user to identify issues related to changes in urine output, discomfort emptying their bladder, and confidence in managing bladder issues. If any issues are identified via the Continence Check, a consumer advisor will follow up, as we discussed, with the call to provide support. The regular self-assessments through the Continence Check help users become more aware of their bladder health, identify issues before they escalate, and get a sense of positive reinforcement when no issues are identified. The Coloplast Care website, the Coloplast Care website is full of dozens of articles divided into several topics. So we have basics such as how the bladder works, symptoms and causes, and why intermittent catheterization, routines, helping to establish sound routines and how to use different products. There are also various articles on hygiene in here and avoiding UTIs. Moving over to lifestyle, so for users who are a little more established, getting back to work, getting back to sports and exercise, traveling, socializing, intimacy, questions, diet and nutrition, and recently we've also added some Canadian catheter user stories for patients to read and kind of gain inspiration from there. Solutions such as finding the right product, how to get products, reimbursement in Canada, and how to navigate that very complex system. And finally, company information, so about Coloplast, some of our innovations, and most importantly, how to reach us. Users can also opt in to receive Coloplast Care emails. The email program is personalized based on the Coloplast Care patient profile, so patients can select different areas of interest and different levels of experience as a catheter user to help customize the email content that they'll receive. The program is also intuitive so that the more a patient engages, the more content will be sent their way. So those who only want occasional information will not be bombarded by emails. Finally, and perhaps certainly of key importance in Canada, is that our Coloplast Care advisors can assist your patients in exploring catheter coverage options. We know the system in Canada varies by province and can be quite complex. In addition to that, there's also private insurance options as well. So Coloplast Care advisors can help patients follow the steps and can provide them with the Coloplast letter of recommendation, which acts sort of as a prescription form and provides a rationale to insurance providers as to why a patient needs to catheterize, the frequency at which they need to catheterize, and what kind of products they need to use. Most importantly, the care advisor will follow up to provide assistance throughout the process. In addition to the clinical benefits of enrolling patients into care, end users just really love the program. So you can see here, the care specialist guided me through the catheter process. Now I can do things on my own and take care of myself, which is a good feeling. 97% of patients surveyed would recommend Coloplast Care. This is a Net Promoter Score, and Net Promoter Score is a commonly used metric with a variety of products and services. So Coloplast Care provides better patient outcomes and patients love the program. So it's a win-win. Now to jump over to products just for a minute or two, we'll discuss better patient outcomes with the Coloplast SpeediCath brand hydrophilic catheters. So a number of studies had demonstrated patients' preference for SpeediCath and improved catheter-related quality of life. SpeediCath was favored in terms of overall performance against a traditional hydrophilic coated catheter in a clinical study, and SpeediCath's ease of use, discretion, and speed were all preferred by users. Looking at a study by Stensbaugh, the objective of the study was to evaluate withdrawal friction forces and urethral trauma with SpeediCath versus two competitor products. Friction is measured because it's a factor influencing urethral trauma, and friction between catheter and urethral mucosa can cause long-term complications. So the result, you can see that hydrophilic coated catheters perform better than uncoated catheters with regards to hematuria and preference, and SpeediCath exerted less withdrawal friction force than the competitive hydrophilic coated catheter. So again, you can help guide your intermittent catheterization patients to better outcomes with SpeediCath and with Coloplast Care. Patients can be enrolled by faxing an enrollment form, which can be provided by your local territory manager. You can call into our consumer support team, also known as the care team. You can send a request by email to casupport@coloplast.com. or enroll patients online by visiting coloplast.ca/careform. That wraps it up. Thank you for joining me today as we discussed better patient outcomes with Coloplast Care and with SpeediCath catheters. Before I leave, I will show one last slide that will list all of the citations for the references that we used for this presentation, including all the studies and clinical evidence, so please feel free to have a look at that. This material is also available in our Coloplast virtual exhibit hall, so please be sure to check that out. And I would be happy to answer any questions that you have. You can also reach out to your local Coloplast territory manager, as they would be more than happy to go through some of the details of the Coloplast Care Better Patient Outcome Study, the clinical evidence behind SpeediCath, or our Coloplast Care program in general. Thank you again.